Now we're talking about the drug addiction and what are the different signs and symptoms. How are you going to diagnose when a person walks into your clinic and you're working as a psychiatrist or you're working as a clinician? How are you going to diagnose that he's suffering from a particular kind of an addiction? What are the signs and symptoms? What can be the different presentations over here? That is the point of discussion over here. Now there are the range of symptoms that you have to distinguish. There can be tolerance, and that is again indicative of the addiction phase. Tolerance is basically defined as when the desired effects are achieved by a much higher dose than the previous doses to which that person was accustomed to. So that is when we are going to regard that tolerance has been achieved in that particular person. Then there is some, basically the withdrawal syndromes are going to be present in that particular person. When the drug is stopped or the person stops taking that drug, he develops those particular kind of psychological or physical symptoms, and those symptoms can be reduced by taking an alternative drug that is quite similar to characteristics in that drug that he was using for his addiction. So these are some of the criterias and these are some of the terminologies that we use whenever we are treating a patient of drug addiction. So over here in this section, we'll be discussing the effects of drug addiction. Now, mainly the two major groups that we usually divide them into are the psychological effects as well as the physical effects of the drug addiction. In this section, we'll be discussing the intoxication and the withdrawal symptoms along with it. Then the susceptibility of that particular person to develop that addiction is again going to be seen in that particular person. And then the risk factors are also going to be taken into account over here. So we're going to discuss those risk factors as well. Whenever we are talking about any psychiatric condition or the drug addiction, obviously there are environmental factors that can prove to be very pivotal whenever we are talking about a particular kind of drug addiction. And then the person himself can have those susceptible, prone features that make him prone to developing that drug addiction. So personality traits are again going to be important, but still the environmental factors, and it can be a series of life events in that particular person, in the life of that person. So if he's passing through any depressive phase, he's more prone to getting addicted to the substance misuse. So again, we have to take into account all of these criteria as well. Whenever we're talking about alcohol, the intoxication is basically defined when there is a disinhibition, the person feels a compulsion to take that drug on a regular basis. The aggression is seen in these people. There is a labile mood. So basically the person is affected from a bipolar affective disorder. There is an impaired judgment, unsteady gait, conjunctival injections are seen in these particular individuals. Flushed face, slurred speech, and nystagmus. On withdrawal, the person basically gives you tremors, agitation. Insomnia is basically defined as the lack of sleep. Malaise is the tiredness or fatigue. And then we have convulsions. Visual, auditory hallucinations are seen in these individuals as well. The opiates will give you an intoxication phase in which they have apathy as well as sedation, slurred speech, psychomotor retardation, pupillary constrictions, interference with personal functioning. Disinhibition is also seen in these individuals. And then we have impaired attention and judgment, decreased levels of consciousness also seen in these individuals. Moving on, if we look at the withdrawal symptoms that are seen in the opiates, it can be the craving, sneezing, yawning, runny eyes, muscle aches are also seen, abdominal pains, nausea, vomiting, goose flesh, recurrent chills, restless sleep, pupillary dilatation, and diarrhea. So these are the collective withdrawal syndrome that is seen in these individuals having addicted to opiates. In cannabis, we have euphoria, disinhibition, anxiety, agitation, dry mouth, tachycardia. That is basically the increase in the heart rate. Then the conjunctival injection, depersonalization, derealization, hallucinations, and there are preserved orientations along with increased appetite. And there is some sort of a paranoid behavior that is due to the suspiciousness and the paranoid ideation that is involved in the thoughts of that person. If we withdraw this cannabis, the person will develop anxiety, tremor, irritability, muscle aches, and sweating. So this is a particular kind of a withdrawal syndrome that is going to happen in the cannabis addiction. Now, the nicotine, basically the person will have craving, malaise, and weakness. Along with it, he'll have anxiety, irritability, insomnia, and there'll be an increased appetite along with tachycardia. Cardiac arrhythmias are going to be seen in these individuals. There'll be a difficulty in concentrating. On withdrawal, there'll be insomnia, bizarre dreams, a fluctuating mood, nausea, sweating, derealization, and interference with the personal functioning. Now, the stimulants, there's a group of drugs which can fall into the stimulants, and the person will develop euphoria, increased energy, hypervigilance, repetitive stereotyped behavior, grandiose belief. The delusions will be of grandiosity. There will be paranoid delusions along with it, agitation, tachycardia, hypertension, nausea, vomiting, weight loss, and pupillary dilatation, along with sweats, chills, and muscular weaknesses. Abusiveness, auditory, tactile hallucinations will be seen. On withdrawal, the person will have lethargy, cravings, bizarre and unpleasant dreams, increased appetites or insomnia or hypersomnia, and psychomotor retardation or agitation will also be seen in these individuals. Now, those with psychological problems are more susceptible to getting addicted to the drug abuse. People can have anxiety, people with depression, psychosis, and those with physical problems, for example, in pain, they can start using a particular kind of a drug to relieve those symptoms. Now, the mechanisms involved in this drug addiction are basically the primary psychiatric or physical illnesses may precipitate as drug addiction, as well as the substance misuse may worsen after this drug addiction. Alternate course of psychiatric or physical illnesses is one of the symptom over here, and then we can have intoxication or substance dependency as well. The substance misuse or withdrawals are seen, and the primary psychiatric disorder may precipitate after its usage as well. Now, whenever we talk about its susceptibility, it can be the substance misuse associated with psychotic illnesses. For example, schizophrenia or the bipolar affective disorder is one of the disorder. Then the person can be in a depressive mode. Post-traumatic stress disorder, eating disorders, for example, bulimia nervosa or anorexia nervosa, attention deficit, hyperactivity disorders, and personality disorders or dementia. There are a lot of biological factors responsible for it, those which cannot be changed, genetic predispositions, age, and ethnicity belonging to a particular race. Then the psychological factors include the self-esteem, early behavioral disorders, impulsive and sensation-seeking behavior, antisocial behaviors, and mental disorders. The behavioral or attitudinal factors, a person's personal traits or personality traits, for example, susceptibility to change, family attitudes to substance misuse, substance use by the family members, or the religious affinity and attendance. So the social acceptability plays a pivotal role in the drug addiction as well. So the environmental or economic factors, it can include the outside from the individual's environment as well. It can include the socioeconomic status of that particular person, the neighborhood is involved, the availability of the local amenities, which require the political involvement as well. So here we discuss the different kinds of the effects that the drug addiction can have on the person who is taking that drug, and even on the community that is surrounding that particular person with drug addiction. So that is the end of this section. Thank you for watching sqadia.com.